I'm Glenn Ayers. I'm the chair of the Greenfield Board of Health, and I'll do a roll call of the members. Dr. Romano.
Hey everyone, I'm present today. Not feeling my best, so I'm gonna keep my camera off.
No problem. Thanks for being here. And member Mimit.
Hi, I'm here. Carrie Mimits.
Great. So that's three of us. That's a full board, and we have a quorum. So I have on the agenda that we can approve the minutes from the last couple of meetings. We could also do that at the meeting on the 26th. I don't remember who is at which meeting. So we have minutes from the 15th and then also from the 28th. So did you have a chance to look at those minutes?
I have not had a chance to review both of those minutes. I think I reviewed the first meeting, but not the second yet.
All right.
Yes, same here. I saw reviewed the first, not the second.
Well, then why don't we approve the first set for February 15th? And I wrote them, so I think that they're pretty good. Anyone have any corrections or additions?
Not that I noted.
I don't know.
All right. Then I'll entertain a motion to approve the minutes from 2:15.
I'll second the motion.
All right. And a roll call vote since we're on Zoom.
Yep.
And so, Dr. Romano.
Aye.
And Carrie?
Aye.
And I'll vote yes. Great. That's out of the way. We can do the other minutes at the meeting on the 26th. The next item on the agenda is public comment period. And are there any members of the public present who would like to make comments?
Hi, I would.
All right. Please introduce yourself, and you can just tell us what town you're from.
Sure. My name is Eden Thompson. I'm administrator of Greenfield Rehab and Healthcare Center, and I live in Greenfield, Massachusetts.
Great. Thank you. Please feel free to offer whatever comments. If this is specific to the item that is later on the agenda, I don't have any problem with allowing you to talk during that discussion. But if you have, if you have anything you want to say, you're welcome to say it now or later.
Sure. Yeah. I prepared it as public comment because I was told that I wouldn't have the opportunity to be actively involved in the discussion. I'd prefer to deliver it that way since that's how I prepared it. And then I'm happy to stay on and answer any questions or have a more fluid conversation during the topic. Sure.
I think that'll work. I think we'll just let you go. We'll let you go kind of first when we start that section. Wanda, if you want to make a public comment, you're welcome to do so.
Hi, can you hear me?
Yes.
Hi, I don't at this point in time, no.
Okay, great. All right, moving on to the next section on the agenda. This is an introduction to Michael, who is here with us on Zoom. I did have a chance to go in and meet with Michael on Monday, I think, which your first day on the job, which I'm sure was hectic. But anyway, welcome to the Board of Health meeting. And if you wouldn't mind, I'm pretty sure that neither Carrie nor John have met with you at this point. Maybe I'm wrong. But anyway, Michael, please introduce yourself. Tell us just a little bit about you and whatever you want to say.
Okay. So hi, Carrie and John. My name's Michael Thero. So I am the new health director in Greenfield. As Glenn said, I did start on Monday. So it's been a busy week just catching up and getting everything organized in the office. I recently come from the state of Vermont. I was working up there in the city of Burlington, being a health inspector for the state of Vermont. Before that, I was the health agent in the city of Agawam. I had worked there for over 20 years in different capacities. The last 7 or 8 years were in the health department. I came up from inspector into the health agent role. Before that, I worked in code enforcement and building department, and then some engineering and different other departments before that. So I come joining you guys with a lot of municipal knowledge, especially about different departments. I also ran my Board of Health in Agawam. We had a very good Board of Health there, so I'm very familiar with Board of Health meetings and running those. So if you guys have any questions for me or anything, feel free to ask.
Awesome. Well, it's wonderful to get to meet you virtually, Michael. I think I speak for all of us when we say that we're really appreciative to have someone with your background involved with the Board of Health here in Greenfield. To introduce myself, I'm John Ramon. I'm one of the resident physicians out of the new family medicine program based here in Greenfield, across the street from the hospital. So really nice to have you. Nice to meet you, and looking forward to meeting you in person.
Thank you. It's a pleasure to meet you as well.
And I echo John's comments. I am personally thrilled that you're with us. I feel like it's a gift to have you here in our town. Little background on me: I'm an RN. I've worked at the same hospital John works at now as an obstetric nurse for almost 20 years. And I have been per diem in the school district in town as a school nurse. And I just accepted the job as a new high school nurse at our Greenfield High School. So that's me.
Great. Nice to meet you, Carrie.
Nice to meet you.
All right. I guess we can move on to the next section and the agenda, but I'll add to my other members of the Board of Health the chair's appreciation of having someone with your understanding of municipal government and various departments is a real asset. Something that we really have not had here in Greenfield for a number of years. And we are very excited and really looking forward to working closely with you. And we've been talking amongst ourselves about coming up with a list of priorities of things that we feel the Board of Health needs to do. And one of those things is governance, setting up governance structures. And so we really want to work very closely with everyone in the public health arena. So I'll move on to the next item on our agenda, which is an update, I'd say, from our public health nurse, Megan Trudrin, who's has a couple of issues for us to discuss as a board. But I think the first thing maybe is just to just give us a short update on the public health nursing program. Very short, but as an introduction to why we want to discuss the two items that follow that.
So our PHEG grant, one of our workforce standards is that we need to work on our tobacco regulations and disease control and prevention. There's a few other things, but those are the ones that specifically relate to the nurses. So one of the things on the agenda is to update the tobacco regulations. The last time we had them updated, it was that I can find in writing was 2015. And since then, the state law has changed. Towns can be more strict than anything in the state law, but you have to do the minimum. So the minimum fines used to be $100, $300, and $500 for tobacco violations. Now they're $1,000, $3,000, and $5,000. And there's also a minimum suspension time. I think we talked about that at one of our other meetings, but we just really need to update the regulations so that it's equitable for everyone, that everyone has the same consequences, no matter what the circumstances, to make it fair. So I drafted up the tobacco regulations that are on there, and it's not up to me what you choose for the dates of like how many days you want to make a suspension. I put 3 in there because we recently had a case last month, I believe it was, where we gave a 3-day suspension instead of a 7-day. So I put 3 days in there, but that part can be changed. The fines cannot be changed. There's other things that you may want to add in there. Some other towns in Massachusetts have put in random guidelines like nobody whose birth date after 2020 will ever be able to purchase tobacco products in the town that they live in. So I don't know if it was Braintree, one of the out east cities. So they made up this regulation that says starting today, you won't be able to purchase tobacco products if you have a birthday of 2020 or later, just so that eventually there will be no more tobacco sales in town. So you have lots of freedom there to make whatever guidelines you want. Emphasize the flavored tobacco issues because there's lots of ways to get around that. And we could talk about that at another time if that's better. Because there's a lot of things that are in court right now about what is a flavor and things like that. So you could put in the regulations, a flavor is whatever we say it is, or, because they're saying there's now something that came out that says non-menthol menthol. And they're saying, well, it's not menthol, but it still tastes like menthol. So, things like that. It's all holding up in court, but it would be easier if it was just in the guidelines to start with. So just any of those type of things. We have a tobacco coalition that we're part of, and they can also help us with any of those things. Cheryl Sabara's on the legal team at Massachusetts Health Board Association, and she welcomes all of our questions. This is one of her specialties. So that's one of the things. We did hire a new nurse for the PHE grant. She's working in Sunderland and Deerfield. She's going to be in charge of all of the infectious diseases there, things like that. But I think, is that all you want me to talk about for the tobacco regulations at this time?
Yes, except maybe to explain that what we're doing is kind of coming into conformance with the other towns in this region so that we have kind of a uniform
So explain
network
the PHE.
of tobacco regulations.
Yeah.
So that we're not out of step with the other communities. And this is kind of a group effort that we all try to do this together. That's why we're part of the Franklin Hampshire Tobacco Coalition, Tobacco Prevention Coalition. I'm not sure if I have the phrase correct, but anyway, we're part of that, and this allows us to continue to participate in that group because it's very important for them that all of the municipalities or jurisdictions within that coalition have uniform regulations because they can't be trying to implement different regulations in different towns, and that causes insanity. So that's underlying kind of the reason why we're doing this. And it is also good practice for boards of health to routinely review their regulations and update them as needed. And so that's part of this effort. Something that was brought up several meetings ago by Megan, that we have a book of kind of regulations and policies that we will want to review and make changes to that, update as needed. So this is, I think, the beginning of that effort. So I think the one thing that we'll need to do at this point is to schedule a hearing for these regulations. So the process is that we publish a notice of our intent to hold a public hearing for the passage of these regulations. And that has to be done at least 2 weeks before the date that we select. And then that'll be published in the newspaper, and it'll be put on the town website as well. And then we'll solicit public input into that process, into that hearing. And then we'll have a period to review any comments that we receive. And then at another meeting, we can decide to incorporate whatever comments we want and then officially pass those regulations. And at that point, they will become the law in Greenfield. So everyone understands the process we're going to follow. And that is according to Mass General Law, Chapter 111, Section 30, 31. 31? I
Just
don't have
one
it in front of me.
quick question, Glenn. In terms
Yep.
of the draft that we distributed for review, if we wanted to make any, if I had a thought about a change that I'd like to make ahead of sort of public comment, is that something that has to wait until public comment, or can that be done beforehand?
Well, if we want to have a discussion about the regulations, we need to do it during an open meeting so that we don't violate the open meeting law. But if you have specific changes that you would like to see, you can write them down and basically just send them to Megan, and she can collect those, and that way we won't be having a back and forth amongst the board members. And then we will review those at the hearing.
Great.
Does that sound like a good process?
Yeah, I just have one small sort of recommendation. That sounds good.
Yeah, whatever
And-
you
and-
want to put in, just give it to me. I'll put it in, I'll run it by Cheryl Sabara on the legal team, and I'll put it in the right wording, and then we can address it at the next meeting. or
All
the
right.
hearing.
Yeah,
Sounds good.
and yep, I'll just say there is some tension between us wanting to maintain uniform regulations kind of regionally, and veering off on a different tangent. I don't think you're going to try to do that, Dr. Romano. But anyway, we do want to make sure that we have the basic structure that is compatible with the other towns that are kind of surrounding us. Especially, I would say, the other ones that are in our shared service arrangement agreement area. So Deerfield, Sunderland, those other nearby towns, Montague, for instance. So we'd like to have a uniform approach to that.
If I can just chime in for a second.
Yep.
So I did review the tobacco regulations. We had just put out ours about 3 years ago. And I will say that your regulations are pretty in line with the ones that we came out. So yeah, any little tweaking you guys want to do is fine, but the general scope of the regulations are pretty much in line with what I did in Agawam like 3 years ago. And we were part of the same coalition. Cheryl Sabara is great. So if you guys have any questions, she's always happy to answer anything.
Thanks, Michael. All right. So at this point, we have to figure out when we can hold that hearing, and I'll have to send out some kind of a doodle poll to see when we're available, or at least one other member besides myself is available. So I'll do that. And then when we set that date, it'll have to be, let's say, 3 weeks out at least, so that we can have the notice published and then the meeting at least 2 weeks after that notice. Sound good? All right.
Sounds good.
Okay. I don't know if we need to actually make a motion, but let's do that just to be official. And I'll just say I'll make a motion to schedule a hearing, a public hearing for the tobacco regulations that will be occurring at least 3 weeks out, maybe further, depending upon availability of board members. And that's the motion. And so we'll do a roll call vote for that motion. So, Dr. Romano?
Aye.
Aye.
Okay. So that motion passes. And that is just to publish these regulations, not to approve them in any way. All right. And so we'll move on now to the next item on the agenda. And once again, this is a discussion about Greenfield Rehabilitation and Nursing Center and communicable disease reporting. And this is something, again, that I'm going to ask Meg to give a little bit of background on. And there was some information in the packet for this meeting that is linked on the town's calendar for this meeting. But Meg, if you would give us, a little background so we understand what we're talking about, and then we'll have a discussion trying to figure out what to do going forward.
So whenever there's an infectious disease at any sort of nursing facility or a school, a recreational camp, they're required to report it to the local Board of Health, depending on what the disease is, within 24 hours. And then they also need to fill out a written report. That written report can be in something called Casetivity or REDCap, depending on what their agency is. For nursing homes, generally, it's Casetivity. Casetivity works with a program called Maven. Maven is the one that I use, and the rest of the state public health departments. And when every day we open up Maven and we look to see what we have for a workflow. In our workflow, it might say that we have to work on 2 TB cases, 2 COVID cases, and a Lyme disease or something like that. So we go in and we call those patients, we do what we're supposed to do for the state guidelines, and then we close the case or follow up or do whatever we need to do. We also have to follow clusters. Clusters is one of the really big ones. So any cluster of norovirus, or even if you don't know it's norovirus, like vomiting, diarrhea, influenza-like illness, anything that seems to be a cluster, even clusters with a bunch of kids who have conjunctivitis in an elementary school, those all need to be reported. So we did send out letters to all of our nursing homes, all of our schools. I believe it was in 2022, just telling them, these are the reportable diseases. This is what you need to do. And we got some compliance. There are some facilities that have not been compliant or that need frequent reminders. Greenfield Rehab is one of those facilities that we have called several times when we might see a couple cases in Maven that never got called into the health department as a cluster, which there's supposed to be a written report and a phone call to the local Board of Health. So we worked with, there's been lots of different administrators at Greenfield Rehab. So we worked with one at the very start of COVID, that woman left, there was another one, that person left. Most recently, the one that we worked with, his name was Christian. And I had sent him emails several times for clusters. I have a stack of them here about all of the emails that I sent him saying, you didn't report again, what are you going to do? I just found out there's another cluster there. And then finally, after several of these warnings and walking them through the steps to upload into Casetivity, we sent out a letter from the Board of Health that said that you must comply, we want this information, because there was even things in there where we said, we need this information by today. He said, yep, I would give it to you today, and it didn't happen. And 5 days later, I sent an email saying, we still haven't gotten the information. So when that original letter went out, it was like the last straw. We had already been asking for this information over and over and over again. So that letter went out in September, and we didn't hear anything from Maven. We didn't see any clusters that we knew about. We thought everything was fine there. But then recently, I got a death certificate, and the death certificate listed COVID as cause of death. So I looked at the address and I was like, this is Greenfield Rehab. So I called Greenfield Rehab and I spoke with Wanda, and she said that she wasn't sure if it was a COVID case, so she didn't report it. And I said, well, did you do a test? And she said, yes, she did an antigen test, and it was positive, but it didn't get reported into Casetivity. So I said, do you know that this is the regulation? She said, yes, I know that these are reportable, but it didn't go through. So I also sent her a reminder email about which diseases were reportable and told her about Casetivity and things like that. So that was on 3/10. The patient tested positive on 2/17. the patient just ended up coming into Maven today. And we also found out today that there had been no reporting starting. Eden can tell us more, but I think it was November, and there was a cluster in December that we didn't know about that wasn't in Maven. So I'm not blaming this administration. This administration is brand new to the problem, that's for sure. But we have had multiple contacts with Greenfield Rehab over the last, well, since COVID started, and have given the facility several directions on this is the law. And I don't know where to go from there, but now you can you can take over. I just told you the report.
Thank you, Meg. Yeah, Eden, I would like you to really give us
Sure.
your perspective, and let's try to figure out
Sure.
how this is occurring and what we can do to solve this problem.
Yeah, for sure. And I think that that's our goal as well. It would be my goal to set up a process in the facility that no matter whether there's a regime change or not, there is still, consistency in the reporting. Wanda is on the phone, and I guess I just want to start with, I'm not sure that, Megan, what you said was accurate. I do have the email that says that where Wanda explains that, no, she wasn't aware. For those, in the meeting, Wanda spent over 20 years at one building as director of nursing in Vermont, just recently came to us in November. I came in December, and prior, from 2004 to 14 was administrator at Buckley, and then was at Farron for its last 3 years of existence. So, certainly astute and have been in the business for almost 20 years and know what is required. However, the gap there was that where we think the gap is that all of the requests and enforcement discussions were being had at a level that they probably shouldn't have been had at. They should have been directed to the administrator of the facility. So when we were first informed on the 10th, as Megan states, that really was our first notification that this is still current requirement by the town of Greenfield. And as I'm sure you're all aware, since COVID began, the regulations for nursing homes in terms of reporting has changed drastically, sometimes daily, sometimes weekly, monthly. So it can be difficult to keep up with who needs what. I will state to you, though, that the thing that has stayed consistent in reporting through all of COVID has been the NHSN reporting, which is the national level COVID and communicable disease reporting weekly, and we have never missed that. And so I say that because it demonstrates that there is a process in the building for proper reporting and consistent reporting. I can't speak to the prior regime as to why they weren't responsive to Megan, et cetera. However, certainly we have been since our notification. And would request that any future notifications go directly to administrator so that enforcement by those who have that responsibility in the building, it actually happens. So that said, we certainly appreciate the collaboration, love the fact that, we're operating in a town that will collaborate with us when there is a situation. I'd like to point out that the cluster, Megan, that you mentioned when we did all the catch-up reporting today was all one incident or one cluster. So I would like to point out there's only, not that any reporting should be unreported. However, it was one cluster, not two separate situations. So, and again, our first notification on the requirement to still report to the local town Department of Health was through Megan on the 10th. So we did have state survey since then, since the 10th. When you called, we were actually in state survey, and I was out sick for 5 days. So Wanda did do her best in the absence to try to gather all of the information as quickly as possible. I worked with her today to get that uploaded, but we do now have a process in place to assure that each time it is reported, and then daily if necessary. We already were doing line listing and such in the building and had that information. I can't speak again to the prior regime and the fact that they weren't responsive at the time, and certainly understand the distress that would cause the local Board of Health. However, I'm not sure that the right people were being notified of the concern. And certainly don't want to speak to anyone's personal situation, but a management regime change was necessary. And it was all happening around that time. So we certainly, I'd like to stress that we understand the importance. I think that's demonstrated through the fact that we do complete the weekly reporting. That has not been missed under our regime and wasn't missed prior, actually, or in any of my tenure at any of the buildings that I've operated at locally. We appreciate the collaboration, and we're really just asking for consideration to, postpone any enforcement and have the opportunity to show you that, we have a commitment to this and that we'll get it right.
I'd like to thank you for coming and explaining that to us. I know that the communicable disease regulations that we're following, which is the Department of Public Health state regulations, they have been in place for, longer than I've been around. And they do require 24-hour notification of the local Board of Health. And the local Board of Health is actually the enforcement entity to make sure that facilities are complying with that requirement to report to the Board of Health. And I'll tell you that these regulations are so old that if we do an isolation and quarantine order, the law, this is the Mass General Law, says that the people that we are quarantined can get recompense from the Board of Health for lost work at, I think it's 3/4 of their salary, not to exceed $2 a day. Not to exceed $2 a day. So that tells you how old this law is that we're following. However, the regulations are actually the thing that is brought up to date regularly. They're revised by the Public Health Council at the state level. And so we are following those regulations. Just to make it clear, they have not significantly changed. The 24-hour reporting has been around as long as I've been involved in this area, which has to be going back into the 90s at least. So that being said, what we have the ability to do is issue fines of $200 per day. Each day is a separate violation of this law, of these regulations. However, I could ask you how much money do you have in your budget for paying fines, but I don't think that that's really what you budget for. I think instead what we would like to do is to, as we say in this business, is we want compliance. That's what we're code enforcement people, and our goal is compliance. So what we want is an assurance, really, that we're going to put in place a system that will ensure that this reporting occurs. I don't know if there is any lag time between Casivity and Maven. I used to do Maven for numerous towns as a health agent in Franklin County. I'm very familiar with the Maven system, but if there is some lag, then we'll understand that there's a lag between when information goes into one system. But typically those things, the servers update things on a regular basis, at least overnight. So I can't imagine that there's going to be several days of lag in between one system talking to the other. But for tonight, for this meeting, let's have an agreement among the parties here that we're going to ensure that this problem does not occur. We're going to do what we need to do to make the communication system work between the administration and the public health nursing program here in Greenfield. So whoever wants to go first and say that that's what we're going to accomplish as a result of this meeting, then let's just make that statement and we'll put that in the minutes. And then if we need to revisit this at some point in the future, we'll be working off of an understanding that we basically have all agreed to here in public, that this is what our intentions are, and we're going to make our best efforts to do this. I understand that things happen sometimes, but we want to have a consistent process so that we don't have the level of frustration or, level of unnecessary concern associated with this. So am I pretty clear on what we want to accomplish? And I'm happy to allow either of the other board members to, chime in at this point. That's what I am wanting to see come out of this, but please add anything else that you think is appropriate.
Yeah, no, I agree very strongly with what you're saying, Glenn. I actually spent last month quite a few days working at the Greenfield rehab with Dr. Villadero, and rehabs are busy, they are underfunded, and they are challenging to run. There's a lot of moving pieces, and I think during a regime change, it's probably really hard to pick up all these pieces. And so I agree that as long as we identify the person who's responsible for the process and clearly delineate what that process is going to be to kind of ensure that it'll be followed in the future and reporting will be on time and accurate, that I really would like to avoid, large fines because I think that would really hamper the patient care provided at these organizations, which is the ultimate goal, is to provide good patient care.
I don't really have anything else to add. I agree completely. I don't think we should fine you at this time. We absolutely should follow what John and Glenn were suggesting.
All right. And even before you say anything, I would like to ask Meg to I'd like her input if she feels that this would be at least a good direction to move in, if this would be a suitable structure to put in place, because I think we need to make it pretty clear that, I was joking when I said how much money is in your budget for fines, because I'm sure there is none in there, but we do have the ability to enforce these regulations. And I am always interested in starting with what's usually called the least restrictive alternative available to us, and then escalating as necessary. So I'm not saying that as a threat. I'm just saying that the Board of Health does have enforcement ability. We're going to do this process stepwise. And so we want to make sure that we all understand we're going to put in place something that will work. And if it doesn't work, then we're going to revisit it and we'll take the next appropriate step. And if that's okay with you, Meg, you're the public health nurse, and we rely on you to do your job, and you feel very responsible about your commitment to public health in Greenfield. So I want to make sure that you're comfortable with this as well.
Yeah, I think that's fine. Like I said earlier, it's not Eden's fault. It's not Wanda's fault. They just got here. But their predecessors were terrible. I don't know how else to say it. It was awful with reporting and getting the information that we needed. So I'd like to see, we'll have Eden or Wanda or what, somebody, if there's an infectious disease, if it's a norovirus, if it's something like that, or cases of vomiting, diarrhea, send me an email. You could do that at midnight. It doesn't matter, because that will suffice for the 24-hour notification. And then if it's a thing on the list, and Eden, I don't know if you saw the list that I sent to Wanda with the, okay. So if it's one of those things, then report it into case activity. And then just, we could talk about it in the morning once I get the email, something like that, just so that we can ensure. Another thing that we had lots of problems with was that in your previous administration, there was only one person that knew how to report into case activity. So I'd like to see you have 2 or 3 people that know how to report into case activity. So when that person's out sick or on vacation or something, things don't get missed. I think that's probably the biggest things, and I don't want you to feel like I'm just picking on you. We have even the hospital at Franklin Medical Center. They send us a list every day of what they have in the hospital for communicable diseases. So it's not like I'm just being strict for you. And I know that you feel like probably that that a nursing home is isolated, but it's not, because all the staff goes home. Then they have kids, they take care of their kids now get norovirus or get COVID, and then they go to school, and then we have huge outbreaks. So it seems like a nursing home should be an isolated entity, but it spreads like wildfire. And that's actually how I found out about the norovirus case, was that an employee had it and then it ended up in the schools. And that's when we do the epidemiology, because we do have an epidemiologist that traces cases, and that's how it came back. So, it's a really big deal. I know it seems like something really small, but I hope that we can make sure that this doesn't happen anymore.
Right. Eden, I would like to give you a chance you can summarize what I said and put it in your own words, and just give us, basically your commitment on how we're going to solve this problem and go forward.
Sure. First and foremost, I thank you guys for the opportunity to have a chance to get it right. Certainly am in agreement that, like I said earlier, collaboration is key. And Megan, having lived through COVID, right, in an institution, I think there's nothing more important than proper line listing and tracing, and in reporting, so that we can get the assistance we need in real time. So everything that was proposed in terms of sending you the email, getting more people on Casetivity and able to report in absence of others, and then I set up other best practices just in regards to follow through in the event that there's a regime change. You have our total agreement. I think that you will find that this will not be an issue for us at the facility anymore. Make your job a little bit easier, and we can deal with things in real time. So definitely have our commitment to that.
Great. Thank you.
Thank you.
I'm feeling, I'd say I'm feeling reaffirmed or confirmed, or whatever the word would be, that your intention is clear, and that Megan will obviously let us know if this process does not work, and then we will engage in, like I said, the next step. But I think that this is the simplest way, the least restrictive way for us to deal with this issue. And again, I appreciate you coming to the meeting and discussing this with us, in an honest way. And we're all part of the same community.
Absolutely.
So I am sorry that we had to, I don't know what to say, do it in public, but that's the way the Board of Health has to operate.
Sure. Certainly understand and appreciate what you guys do for our community as well.
Yeah, we have to do it during an open meeting. So
sure.
Do you have anything else to add, Meg? Okay. Well, she's good with that. Michael, did you have anything to say about?
I think that's a good idea going forward. Obviously, we don't want to, slam the hammer down on the first couple offenses. And as we understand that clearly, with the different changes of people and everything, that there was different issues that were going on that obviously we're not going to just blame you for. So I think that's a good idea. I think, we go forward, and I think, we just stay with the understanding that if it keeps happening, then we obviously have to escalate our enforcement.
Certainly.
Okay. All right. I don't know if we need to make a motion. If someone wants to make a motion about this, it was a discussion. I don't really think we do at this point. I think we really just brought this, to the board's attention, and that we're going to keep an eye on it. And Megan is really going to be our eyes on this, and she will let us know if we need to put this back on the agenda, for future discussion or taking some kind of action. But again, I want to say thank you to Eden and Wanda, even though you didn't say anything, Wanda. I'm sure you heard everything. And so we feel like this is a cooperative effort for public health, and we want to be reasonable in how we enforce things. And honestly, my personal feeling is that fines are a last resort, but based on the history, there was some feeling that this has been going on for a long time. We're aware of this now having the potential to, really be fixed and go in a different direction. So we appreciate that very much.
Thank you again.
All right. And I do have a couple of things about old business in here, and that is to remind folks that as members of the Board of Health, we're supposed to be ICS certified, and I don't know if either Dr. Romano or Carrie, if you have done any of those trainings. That's the Incident Command System and the National Incident Management System, NIMS. But I think I put links to those in the agenda that I sent out. And what we should do at a future meeting is kind of list if we have accomplished those goals, because this, again, is part of the overall effort under the Public Health Excellence Program in Massachusetts for Board of Health members to come up to a certain level of competency. And part of that is emergency response training. So I have had all of those trainings in the past, not to brag, just because it was part of my job in the past, but we do want to, those are all available online. And then the other item on the old business was updating something we talked about, our regulations and local regulations. And that's something that I'm interested in looking at. And so I'd like to work with Michael or Meg or whoever has that book and get a digital version, scan it in, get a digital version of it prepared so that we can review it, at our leisure. And then schedule that for a discussion at a future Board of Health meeting. So that's just kind of getting to the end of the agenda. I'm happy to allow anyone to bring up any items that they feel came up during the meeting or that they want put on a future meeting. And I did put an agenda together for the 26th, which is pretty full, and it's only going to be an hour-long meeting. And I'm hoping, Michael, that you will be available for that meeting as well. And then I'll make an announcement that there is a PIP meeting, the Public Involvement Plan meeting for the Lunt cleanup, that will be starting at 6 p.m. on the 26th. So that's why that Board of Health meeting will only go for an hour. And as we decided at a previous Board of Health meeting, upon request by the mayor, the Board of Health is taking over the implementation of the Public Involvement Plan. So at the meeting on the 26th, starting at 6 p.m., we'll be discussing revisions to the Public Involvement Plan itself, the plan it's called. So the board members are welcome to that. It won't be an official Board of Health meeting because it will be a PIP meeting, essentially. So any other additions, comments?
So the only thing I was going to bring up just for maybe future thinking is It was something I was working on in Agawam before I left. It was just a local regulation on body work, we called it. So it was just kind of set aside from massage regulations and tattoo regulations. It was focusing more on different kind of body work regulations that aren't really licensed under Mass DPH and don't really require licensing. We had some issues in my former municipality of so-called massage parlors that weren't licensed as massage parlors, that were kind of falling into that gray area of body work. So I think that's a good thing to keep in mind. It's kind of a preventative regulation. I think it closes that loophole between massages and some of these places that kind of come off as massage parlors but aren't licensed under Mass DPH. So just something to keep in mind. I can probably get some drafts of regulations from other towns that we can take a look at in the future. But I think it's a good preventative regulation to have, just to kind of close that loophole between massage parlors and then places doing so-called body work.
That'd be great, Michael. Thanks. I would appreciate taking a look at if you could put it together a little example for that, and maybe we can look to see if any of the communities around us, like Montague, for instance, also have something like that in place. And it might be something that it might be a suggestion for the entire kind of Valley Health Alliance to look at that as well. So.
Sounds good. I can do that.
Okay. All right. So I think we're ready to adjourn. I'll take a roll call vote. I'll make a motion to adjourn this meeting and take a roll call vote. So, Dr. Romano?
I vote aye to adjourn.
I vote aye.
Great, Karen. And Ayers, yes. So the meeting is adjourned at 5:55.